welcome. It's nice to see everyone here, and we have an audience on WebEx who are listening in as well. I'd like to introduce Carolyn Lamparella, who is the director of the Employee Assistance Program, Preferred EAP, and welcome her this morning.
Great, thank you. Okay, good morning. So normally I am a hand talker and a mover, and so it might be a little difficult for me to stay contained, but I'll do my best. And so there is nothing like talking about stress at 8 a.m. after driving for 45 minutes on 22. Yay, right? So every time I do this presentation, I have some kind of stressful event before it occurs, and it challenges me to practice what I preach. So this morning, what I'm going to talk about, I thought it would be helpful to start with just kind of giving you an overview of stress. I mean, we talk about stress all the time, but I think often we don't really understand how it works in our body and the effect that it has on us. So I'm going to start with that and then talk a little bit more specifically about how you can think about the environment that your employees are working in and stressors that they might be experiencing and strategies that you can employ to hopefully alleviate some of their stress. I mean, obviously, we're not going to get rid of all of it, but really what we're hoping for is to find some type of balance. So, and please ask questions along the way. I am going to stop and make sure that we have time for questions, but you know, as I'm going along, please feel free to interrupt me and ask questions. So I think this sums it up pretty well. Right? All we have to do is wake up in the morning and go to work, and we're going to experience stress. There's no way to avoid it, right? And really, stress in and of itself is not a bad thing. You know, stress has really gotten a bad rap. But, you know, think about it. If we are, you know, the only time that we're really not going to be experiencing stress is when we're dead, right? Stress is part of our life, and there's no way to avoid it completely. So we might as well embrace it and figure out how to manage it. So before I move on to talk about us humans, I want to talk about zebras, right? Because these poor zebras have a pretty stressful life, right? I mean, think about it. Zebras are in danger of being eaten by this guy every day, right? And so zebras really have a much more stressful existence than us humans. However, for some reason, humans get ulcers and stress-related disease, and zebras don't. We're not in danger of being eaten by a lion. We might be in danger of being yelled at by our boss, right? And that may feel like you're being eaten by a lion, but really it's not the same, right? So why is it that humans experience all this stress-related disease and zebras don't? They get confronted by a lion, looks pretty scary. What do? What does a zebra do? They run. They run. When was the last time you were able to run away from your boss? Right? Your boss is yelling at you, excuse me, I got to go for a quick jog. I'll be right back, right? We don't have that opportunity. Zebras experience danger, they experience the stressor, and then they deal with it, and then what happens? They're hanging out by the stream with their buddies, right? They're back to relaxation mode. Do you think any of these zebras right now are obsessed about where that lion is? Are they replaying the scenario in their mind over and over and over again? Are they worried that it's going to happen again? No, right? We humans, we are so awesome that we are the only species on the planet that can think ourselves into a stress response. Zebras, their primary concern is the actual confrontation by a lion. We are spending time all day long worried about the lion. afraid that the lion is coming back. How can we avoid the lion? Right? This is a major source of stress for us. This is what I love this slide. I stole this from Dr. Pelosi. If you feel totally overwhelmed looking at this slide, you're supposed to, right? Because this is a physician's perception of stress. It's very complicated, the way it works in the body, right? The effect that it has. I prefer this slide. I like cartoons a little better than that other slide. This is the way I think about stress. I describe it as two parts. We've got the on switch and we've got the off switch. Sympathetic nervous system, the fight or flight, that's the part of our stress system that prepares us to deal with the challenge, that activates. This is what we typically think of when our heart is racing, when we're zeroing in on whatever it is that we're dealing with, right? That's the sympathetic nervous system at work. And most of us don't really need to practice that very much because we're practicing it all day long. This is where we spend most of our time in this activation phase, right? This part, the parasympathetic nervous system, is the off switch. This is what helps us stay in balance. But for most of us, we have stressful jobs, and then we get to drive home on 22 in traffic, and we're not coming home, most of us, to, a nice tub that has been drawn for us, right? A clean kitchen. I just came home last night. I have 2 teenage boys, and I'm like, what the hell? Can't you clean the kitchen once in a while, right? So we're not coming home to stress-free environments, So what we are find ourselves in is a state of chronic stress, where we're never in this relaxation mode. And the zebras, that's what happens to them. After the lion is gone, the parasympathetic nervous system engages and they stay in balance until they're eaten by the lion. Poor zebras, right? So how do we deal with that? Because most of us walk around out of balance. And this is another representation. Stress, as I said, is not such a terrible thing. It helps us deal with challenges. But as you can see from this diagram, when we're in that state of chronic stress, then we experience adrenal fatigue. That's when the exhaustion kicks in. That's when all of the stress-related diseases begin, when we're in that state of chronic stress. So how do we find ourselves in balance? Now I'm going to try. Oh, good, it worked. I want to show you a video. This is, when we talk about our thoughts and how our thoughts impact us, what is it that we're really talking about? Because, one of the things that is great about humans is that we have the ability to anticipate danger, anticipate problems. And so our brain is constantly surveying the environment and gathering information in an attempt to protect us. This is referred to as the default mode network. This is a part of our brain that is constantly working. These thoughts are constantly in the background. So this video kind of gives you an explanation of that. Let's see if that works. Do we have sound, do you think?
What's going on inside
We
your
need
head when
sound
your
here.
While it may feel like flipping on a screensaver, our brain is still very much.
Give it a shot.
I will start that again. Can everybody hear that? See if we can. I think we can increase that volume.
Cortex and medial temporal lobes. There is still much debate as to what these cortical associations mean, if anything at all. One theory implicates them in introspection and mind wandering, essentially our stream of consciousness. This includes any thoughts not directly associated with the immediate external environment. Much of our waking hours are composed of stimulus connected thought, whether it be daydreaming, planning out our future actions, revisiting memories, or just listening to yourself narrate out your day. Another theory posits that the network's activity is the brain's baseline of processing and information movements. Separate from conscious thought, these activations will represent how our brains consolidate experiences and prepare to react to the environment. We're exposed to a constant stream of information from our surroundings, so maybe the default mode network activations are somehow in charge of making sense of it all. But even though neuroscientists haven't completely agreed on what the default mode activations mean, it's clear that resting state research is bursting with potential and applicability. Various psychological disorders, including ADHD, schizophrenia, autism, and Alzheimer's, exhibit different types of abnormal functioning in the default mode network. In the end, there are many interesting directions to take resting state research, from picking apart the neural correlates of consciousness to uncovering better ways to detect, understand, and maybe even treat psychological disorders.
So, have you ever had the experience of driving home and you pull into your driveway and you go, how did I get here? Right? You have no recollection of the actual route that you drove, and you're in your driveway going, oh geez, I hope I didn't run any red lights or blow a stop sign, or because we are so engaged in automatic behavior throughout the day, right? And during that time when we're driving home and our mind is wandering, are we usually thinking pleasant thoughts? Are we usually feeling really great and optimistic, or are we replaying everything that just happened during the day? Or are we worrying about what we're going to be walking into when we get home? There's some really interesting research that has been done on mind wandering, where they have people with smartphones being signaled throughout the day. And every time they're signaled, they're asked to report, their mood and their thoughts. And what they have found is that the more we engage in mind wandering, the more we just allow that default network to be operating and to dominate our consciousness, the less happy we feel. We feel more stressed, we feel more depressed. And they're showing that in certain mental health disorders, this default mode network is incredibly active. And so active that it just dominates that individual's consciousness. And so again, if you think about stress from the perspective of balance, if this network is so active, it throws us out of balance. So when we're talking about managing our stress, what we're talking about is finding ways to create balance. It's finding ways to override this default mode network. This is a great resource that I highly recommend you take a look at. And this is, the rest of our time together, I'm going to talk about a tool, something that comes from the toolkit that is presented in this from this website. This, is anybody familiar with this? Has anybody ever taken a look at this, workplace mental health? It is a tremendous resource for you as an employer to understand, the impact of mental health on your workforce and to come up with strategies for assisting them. So what I'm going to talk about comes from the toolkit. They do. They have a lot of great, if you go in there, they have case examples from all different industries, from manufacturing to healthcare to, the corporate world. It's a tremendous resource for you. So when they talk about, dealing with mental health in this toolkit, the first thing they talk about is knowing the impact. Okay, so there are a lot of, I could stand up here and present tons of statistics on the impact of stress and mental health in the workplace. Here are just two that are incredibly impactful. 83% of U.S. workers suffer from work-related stress. Businesses lose up to $300 billion, yearly as a result of stress. All of that is great. These statistics are very impactful, but you have to know your work setting. You have to truly understand what your employees are experiencing. And the only way to do that is to survey them, is to look at data from your industry and really understand, what is the impact of stress on your employees? Where is that stress coming from? What is their number one source? You can look at healthcare data. What services are being utilized primarily. You can look at FMLA, statistics. It is estimated that FMLA, is primarily for mental health problems. It surpassed cancer, diabetes, and heart disease as reasons for FMLA. Mental health is the number one reason that folks take FMLA. And stress, of course, exacerbates anything that's going on, physically, mentally. So you need to know the impact. Here at the Health Network, we do employee surveys, and one of the things that we did this past survey was we asked about burnout. We asked specific questions related to the stress of their environment. And we were able to identify areas, that are higher risk based on the work environment. And so one of the things we're doing as an employee assistance program is we're targeting those areas, and we're trying to go in and uncover what are the factors that are contributing to this burnout. And it's a way for us to sort of narrow in on, okay, let's at least start with these folks who are self-identifying as burnt out. I worked with another department recently where I interviewed, they were really concerned because there was a lot of turnover, and the employees were presenting with tremendous stress, and they seemed to be more agitated than normal. And so I went in and I interviewed all of the staff. And the one variable that came up over and over and over again was related to the schedules, the way the schedules were developed. It was preventing the employees from having any balance in their life, any predictability. So what was awesome is these employees all came together and they came up with a scheduling system, and they proposed it to their management team. Now, I have yet to find out whether or not the management team has embraced that or whether they're working with them. Because one of the challenges we face is culture. What is the culture? One of the things that we deal with in healthcare, and you hear this from, workers like nurses, physicians, people who've been around for a long time. And they'll say, well, I had to deal with it, so should they. They should. Suck it up, buttercup. Right. Suck it up, buttercup. Unfortunately, that creates a culture that makes people feel very disempowered and helpless. And that was a little bit of what was going on in this setting. It was sort of like, well, back in the day, I was just happy to get Thanksgiving off. They shouldn't be expecting all these things. So you have to be really aware of the culture that is created, in your setting, and the impact that it's having. Any questions or thoughts about that?
I think as managers, we have, the folks that are in a management position, we have to keep in mind that we can't think of everything. We have great resources right below us.
Exactly.
That's working with these things day in and day out, and just ask them what they need from us.
Yes.
To do your job right. Maybe we're going to say no, but at least we gave them a shot.
Right. I've had so many times where employees have said, we know that the staffing situation, we're understaffed. We know they're trying, so that may not be a solvable problem. But can you at least show us some acknowledgement? Can you at least recognize? Can you at least say, I know that you're having to work a little harder because we're understaffed. Can you at least have that acknowledgement, rather than just suck it up and deal with it? Go ahead.
I just, for the web, I need to speak to the people in the WebEx.
Okay.
I apologize. I usually make the public service announcement. If you're on the WebEx, if you look at the actual screen where the presentation is, you scroll over it on the bottom, there's some round circles. One of them looks like a cartoon bubble, text bubble. If you click on that, it opens a text window on the bottom right, so you can send any questions in there. If you do have any questions for Carolyn. And the one that just came up as we were standing here, someone asked to repeat the question and what Carl had said. Carl's question. But you have to do that because of the microphone. So,
Which one was that?
What? Oh God, no.
well, the question was essentially, it was more of a comment that,
yes.
Right.
yeah, managers have to look to the staff to see if the staff has some solutions to resolve the problem, is what was stated. Yeah, so unfortunately, we don't have the whole room mic, so if someone does have a question,
so I should repeat it. Yep. Okay, very good. Sorry. Yeah, and so, back to that, I think it is important to survey your employees because they really are your greatest resource on identifying the stressors that are impacting them. The other thing that is recommended is to break the silence. We've got to get better about talking about mental health. We just have to. I love this this quote from Fred Rogers. If it's mentionable, it's manageable. Okay, so we have to look for opportunities to, number one, train our leadership. Our leadership needs to be comfortable talking about mental health and stress. They need to be able to share their own experiences with their employees so that they set the tone and help employees feel comfortable, acknowledging that they are struggling. And that, again, culture really impacts that. We do a lot of work here with physicians, residents, and nurses. And, people in the healthcare industry, they have a very hard time self-identifying as in need because they're caretakers, right? And so they feel weak if they aren't able to perform, day in, day out. So we've got to create a culture. We've got to be talking about this with our folks and look for opportunities. What I usually tell people is every time your employees gather, you should be acknowledging the stress, the mental health impact of what they do day in, day out. You should have that conversation. It should be just normal. And when you do that, and especially as what's really impactful is if you as a leader have had struggled at some point in your life, perhaps you use your employee assistance program. Share your story. You don't have to share all the intimate details, but share with your employees. Yes, I went there. I went through a tough time and I went to, get help and it really made a difference. That's how you get your employees to feel more comfortable reaching out for help. Another great resource for you is Mental Health America. They have tons of resources, but one of the things that is really helpful is screening tools. You want your employees to be able to self-assess. Encourage them to go on this website and complete some of these screenings. It's important for them to feel comfortable assessing their situation, so that they can identify what they need. Deliver affordable access. Of course, this, you're not, I think everyone here represents safety. Is that correct? I know some people are from HR. Some people are in charge of the benefits, and of course, mental health is a concern. Insurance companies are better than they used to be with making sure that mental health is treated in the same way as our physical well-being, but you need to make sure. You need to make sure that people have access. If you don't have an employee assistance program, see if you can add something like that to your work setting, because that is a great way for employees to at least get exposed to mental health, and in a less intimidating way. You know, if you have an EAP program, bring a, you know, like I always encourage, bring us on site, put us in front of your employees, make them understand how accessible the services are so that they recognize how to get help. The other thing to think about is building a culture of well-being. And this is where I'm going to talk about what do we actually mean by that, building a culture of well-being. What actually works? When it comes to stress, what we are talking about is inserting pauses. There is stress at work that is unavoidable. There are certain environments that are more stressful than others. And we're not going to be able to eliminate all of that. I just met with a unit last night, and their unit deals with trauma. And so, you know, one of the things that the nurses were saying is we are literally on our feet all day for 11 hours where we are dealing with situations after situation after situation. That's the reality of their job. That's not going away. You know, that's not going away. But they can approach that by just sort of plowing through and never pausing. Or we can think about how do we weave in pauses? How do we create moments where you can be mindful, moments where you can breathe? You know, we're not talking about 20 minutes of meditation, you know, during your shift. We're talking about making it part of the culture where you as a team, you as a leader, recognize when someone is feeling excessive stress and you go to them and you say, take a moment, you know, take some deep breaths, pause, you know, and every time we do that, the good news is every time we insert that pause, we're engaging that parasympathetic nervous system, you know, bringing on that relaxation response. And the more we do it, it's like learning a new language. The more we do it, the better we get at it, you know? And so we may not be able to carve out 10 minutes, but we could do a minute, maybe 10 times, you know, over the course of our shift. You know, and again, that's where it's important to know your industry, to know the opportunities. When could this occur for your folks? When could this happen? In manufacturing, it's going to look very different than in healthcare. You know, so a one size does not fit all. Taking 5 deep breaths. How many people in the room meditate? A couple people. Okay, I know, Jen over there. Right. We often, when we think about meditation, we sometimes have this notion of, you know, sitting quietly, you know, in a dark room, you know, where we have no thoughts going through our mind. You know, we think, oh, that's meditation. Well, I can't do that because if I sit still, my mind starts racing, you know, and so forget it. Meditation isn't for me. But meditation truly is the best way to calm that default network. So what I'd like for you to do, I'm gonna give you a quick meditation exercise, if you don't mind. I would love it if we could turn the lights down. Scott, turn the lights. What I want you to experience is what it feels like to just take 5 deep breaths. Okay, to just focus on 5 deep breaths. We're not going to do a 10-minute meditation, but oh, we're going the wrong way, Scott. And those on the WebEx, feel free to take some 5 deep breaths. That's good, Scott. So what I want you to do is you can keep your eyes open or you can close your eyes. What I want you to experience is 5 deep breaths to the count of 5. 5 in and 5 out. And what I want you to concentrate on is how your breath is moving through your body. So I want you to feel your abdomen expand. Most of us, when we take a deep breath, we do it all up here. What I want you to think about is just expanding your abdomen. Okay? So we'll start with just taking a deep breath in. There you go. You just meditated. How did that feel? 5 deep breaths.
I think it would have been a little bit easier to get a little more air in before Thanksgiving.
Oh. That's whatever. It was nice. But that's okay. Have less stressful lighting. How about that? So, I mean, I don't know what your response was when I suggested this. I always love looking around the room. Some people are like, oh, here we go. Like, oh God, we're going to meditate now, I mean, there's always a lot of eye rolling that's going on. But I want you to understand that those 5 deep breaths took less than a minute for you to do. And I want you to just reflect on what it felt like just to slow down and to focus on your breathing for less than a minute. And how much that actually creates a pause. It interrupts our thoughts. It interrupts the stress. And it creates an opportunity for doing something different. So I want you to think about your employee population. What are the opportunities? Someone's not on mute. And what are the opportunities for them to breathe, to insert those pauses? I think often about manufacturing, and I remember years ago when I was in graduate school and I worked on this job where I was working on an assembly line and doing that same motion over and over again. And I remember, just how difficult it was engaging that repetition. But looking back, I now know how many opportunities there were for me to tell people that they're not on. For the folks that are on WebEx, can you make sure to mute because we're hearing some extraneous noise? Keep going. Okay. So in manufacturing or in healthcare, in any industry, we have to think about creating ways for our employees or encouraging them to take that moment to just breathe. Okay, are we good? Yep. Mindfulness. Mindful meditation. It's a form of meditation, and it's very much misunderstood because there is a belief that when you are meditating that your mind should be clear of thoughts. And that is really not what it's about. It's about the discipline and the practice of catching your thoughts wherever they are, not judging them, bringing yourself back to center. And I know, for example, Lehigh Valley Health Network, they have a center for mindfulness. They have great meditation programs. They're fairly intensive, so it's not everybody is able to do that. They have one program that is 8 weeks and a new program they just developed that's 4 weeks. That may be too much, but think about having lunch and learns where you bring in somebody who does a meditation exercise, just to teach your employees about meditation. If you are a skeptic when it comes to meditation, I want you to watch this video. This is Anderson Cooper. Has anybody ever seen his 60 Minutes where he talks about mindfulness? So he apparently was struggling with anxiety and became a meditator, really learned the practice of mindfulness. And this will show you an example of.
At the University of Massachusetts, Judson Brewer, a psychiatrist and neuroscientist, uses mindfulness to treat addiction.
This is just the next generation of exercise. We've got the physical, exercise components down, and now it's about working out how can we actually train our minds.
Dr. Brewer is trying to understand how mindfulness can alter the functioning of the brain. He uses a cap lined with 128 electrodes.
We're going to start filling each of these 128 wells with conduction gel.
The electrodes are able to pick up signals from the posterior cingulate, part of a brain network linked to memory and emotion.
This is all just picking up electrical signal from the top of your head.
Since attending the mindfulness retreat, I'd been meditating daily and was curious to see if it had an impact on my brain.
We're going to have you start with thinking of something that was very anxiety provoking for you.
Okay. When I thought about something stressful, the cells in my brain's posterior cingulate immediately started firing, shown by the red lines that went off the chart on the computer screen.
Just drop into meditation.
Okay. When I let go of those stressful thoughts and refocused on my breath, within seconds, the brain cells that had been firing quieted down, shown by the blue lines on the computer.
That's really fascinating to see like that.
Dr. Brewer believes everyone can train their brains to reach that blue mindfulness zone, but he says all the technology we're surrounded by makes it difficult.
If you look at people out on the street, if you look at people at restaurants, nobody's having conversations anymore. They're sitting at dinner looking at their phone because their brain is so addicted to it.
You really think there's something in the brain that's addicted to that?
Well, it's the same reward pathways as addiction, absolutely.
I'm, on mobile devices all day long, and I feel like I could go through an entire day and not be present.
And what's that like?
It's exhausting.
Yeah. So all of this is leading to a societal exhaustion.
What did you think about that? So what they have found is that people who practice mindful meditation when you look at that graph, at resting state, the red is so much less than the blue at resting state. And at resting state, that's when that default mode network is most active. So when the red was firing, the part of the brain is the same part of the brain that is active when our default mode network is active. So, anybody who is skeptical about meditation, thankfully, the science is now there to back it up. And, it's by far one of the best ways for us to address stress and anxiety in particular, is to learn how to develop some type of meditation habit, whatever that looks like. The good news is it doesn't have to be 20 minutes. It doesn't have to be an hour. You can start with those 5 deep breaths and just make it a habit. Make it part of your normal routine. And over time, it has a cumulative effect, just like stress has a cumulative effect. So just like we are able to bring on a stress response with our thoughts, we're able to bring on a relaxation response with our thoughts. So it's just something to be really aware of. Sleep. How many of you attended the session that was done on sleep? Right? Pretty impactful, right? We now know, we know so much more about why it is important to sleep. If we're not sleeping, then, this protein builds up in our brain that is associated with Alzheimer's and dementia. But what I'm wondering is how many people in this room get enough sleep? How many people are really intentional about making sure that they're getting a full night of sleep? Few people, right? We are still, once again, like the zebra, we humans are different than the zebras in that regard. We're the only species that deprives ourselves of sleep on purpose for no good reason. There is absolutely no benefit to us depriving ourselves of sleep. Yet we do it very intentionally. And for some, it is part of the culture. There's this belief that you are somehow superhuman if you only need 4 hours of sleep. Think about your employees and how much education have they received on sleep? How much are you talking about sleep with them? Good sleep hygiene. There's an opportunity. There's an opportunity there for education, because a good night's sleep is your best defense against stress. We do a lot of work with the brand new nurses. They have a nurse residency program at the Health Network. And almost all of the new nurses, unfortunately, have to work night shift. And one of the things I ask them is, How's that going? What kind of education have you received about night shift? About how to manage your sleep pattern in a way that is less debilitating to your well-being? And most of them say nothing. We haven't gotten any, education about it. It's really important for us to be talking about sleep with our folks, and because that makes a difference. And so many, this is where meditation can be really beneficial as well, because meditation first thing in the morning and right before you go to bed is when it is most effective, because we are in that theta brainwave state where we're already sort of close to a meditative, existence right when we wake up and right before we go to bed. People who have sleep disorders, adding meditation to their sleep routine can be really helpful. What are some other things? Exercise. We know this. We know that exercise helps us manage stress. I know at the network with our corporate wellness, we have a lot of exercise challenges. How do you encourage your employees to move? What kind of incentive do you provide for them to get up and move? Do you have walking clubs? Do you have walking paths? Do you have challenges, with your employees that encourage them to move, to just get up and move their body? Exercise, we know that we feel better when we exercise, but exercise actually insulates us from stress because it produces something called BDNF, which is like fertilizer, for our brain. And it helps to prime us for learning. The research on school systems that have implemented exercise, the correlation between the exercise programs and test scores is really remarkable. That just by getting kids physically moving, they're more able to deal with challenging tasks. They perform better, on test scores. Gratitude. We know that at the end of the day, when we've had a bad day, it's tempting to vent, right? We all like to vent. It feels satisfying, to complain about what we experienced. But unfortunately, when we're doing that, we are adding to our stress because we are replaying the scenario over and over again. And the effect that has is it increases our stress. Our brain doesn't know the difference. If we experienced a stressful event and then we talk about it with somebody later, the brain thinks it's still happening. So it's still responding as though it's happening. If we focus instead on gratitude, and I know I've seen some work sites where they have like a gratitude board. I walked into, I think it was one of the L-Tri-C sites. I think it was in Monroe County. And I walked in and down the hall, they have these huge gratitude boards where all the employees, are posting their daily gratitude, on this board. And it was great. I walked in and I just stood there and read what all these people were grateful for. Completely changed, the way that I felt in that moment. Think about that. Think about your break rooms. What do your break rooms look like? What do you have posted in your break rooms? What do your employees see, when they walk in there? Do they see things that will make them feel calm and peaceful and grateful? Or do they see things that make them feel stressed out? I mean, these are things that you can be thinking about, because again, you're not going to be able to remove all of the stressors. It's about creating a culture. It's about weaving it in. It's about the messages that you send every day. So, talked about, some things that help impact stress. We all have goals, right? We set goals for ourselves. And we tend to be a goal-oriented society. So you might walk out of here with some goals, of how to address your employees' stress, things that you can implement. But as this quote comes from James Clear, who wrote a book called Atomic Habits. And if you are interested in behavior change, it is by far the best book I've ever read on behavior change, by far. and I read a lot. Trust me, I read a lot of books on behavior change. What he talks about is we don't rise to the level of our goals, we fall to the level of our systems. Think about your work setting. What are the systems in place? I don't care what your goals are. If you don't have a good system, you will not accomplish your goal. If you have a goal of your employees eating healthier, but yet every time you walk in the break room, there's junk food everywhere. Every time you have a gathering, you provide pizza and pastries. You're not going to accomplish your goal. And it's not because you don't have good intentions. It's because your system needs to be improved. So when we talk about systems, we're talking about habits. So think about your employees' daily habits. What are some things that happen routinely? Behaviors that occur over and over and over again become habits. How do we address the habits? When you gather your employees, so one of the things that happens here at the network is that daily report. On shift change, there's a daily report. What are the habits that are associated with that daily report? What are they talking about every time they get together? Are they talking about gratitude, appreciation? Are they talking about statistics, numbers? Think about that. Those are small moments, but if they happen every single day, they add up. So one of the things that I hear from nurses in particular is every time we get together, they talk about numbers. They talk about statistics. It's demoralizing. We never talk about, geez, we saved somebody last night. We're not having those conversations. So these are daily habits. Now, all of the directors have a goal of making their employees feel valued and appreciated, right? It's not that they want them to feel underappreciated or devalued, but their habits, their systems don't support it. And so we need to be thinking small behaviors. How do habits form? This is James Clear. This is his representation of, how habits develop. They begin with a cue. It creates a craving. And what is the craving generally? The craving is generally related to an internal state. I'm bored. I'm sad. I'm angry, right? That's the craving. I have this cue and I don't want to be bored anymore. So here's my phone. I'm bored. That's my craving. What's my response? I pick up my phone. I scroll through Facebook. Guess what? Not bored anymore. Worked. Repeat. This is how these behaviors develop. So if you are going to evaluate the systems at work, you need to be thinking in terms of what are the cues? What is triggering this behavior? What does my environment, what does that work environment look like that is triggering maybe behaviors that you'd like to see stop? You've got to think very small behaviors. How do we create good habits? You got to make those cues obvious. Again, think about your work setting. If you want your employees to eat healthier, if you're encouraging them, to stop smoking, what are the cues? What are the things that you're putting in front of them? For all of us, if we're trying to develop an exercise habit, right? And we wake up in the morning and it takes like 20 minutes to figure out where our gym clothes are or where our sneakers are. It's not an obvious cue. But if you wake up in the morning and your sneakers are right there, your gym clothes are right there, it's a very obvious cue. You're trying to eat healthier, you open up your cabinets, there's not a single healthy item in there. You have to actually drive to the grocery store to go purchase those healthy foods. It's not obvious, right? We've got to make these cues very obvious. We've got to put these things right in front of people to make it as obvious as possible. We've got to make it attractive, right? If we want people to exercise, we want them to move, we got to have attractive challenges. You know, we've got Aaron back there is, you know, you could speak to that, right? All these, you know, cool incentives that we provide. We try to make it attractive for people to engage in this behavior. You got to make it easy. You know, you have to make it easy. We often, unfortunately, when it comes to behavior, we put way too much emphasis on willpower. We think that people who are successful have greater willpower than we do. They don't. They just have a better system. They design their environment in such a way that it makes it easy to engage in that behavior. I mean, we talk about this all the time. You know, when you walk into the cafeteria, what's the first thing you see? If the first thing you see is, you know, cookies and pastries and, you know, that type of food, you know, it's going to be so much easier to get that food than the healthy food that might be all the way in the back. I mean, this is the kind of thought process we have to have, you know, in order to make these behaviors better. Willpower is only going to account for about 5% of our success, because willpower is like a muscle that fatigues. And that's true for your employees as well. Make it satisfying. Create some type of reward. I often tell the story of one of my clients who quit smoking. And the way he did it was by, he had a chart that he put, you know, or a calendar that he hung up in a place where he could see it. And every day that he wasn't smoking, he put an X on it. And another X. And before we know it, it was like a month. And the reason he stopped smoking, because he didn't want to break the streak. That calendar was so satisfying to him to see that it worked. And so he quit smoking because he didn't want to break the streak. We used that very same principle for him when he was trying to wake up early in the morning. He wanted to wake up at 4:30 every day. We tried all kinds of things, and I said, how about your alarm clock is right underneath this big chart, that when you wake up in the morning, that's the first thing you see. And every time you wake up at 4:30, you put an X. The last time I saw him, it had been 6 months. He woke up at 4:30 every single solitary day. Why? Because it was satisfying to him. Would that work for me? Would that work for you? Probably not. But you've got to find what works for you. You've got to find what works for your employees. What is satisfying to them? What is going to encourage them to change their behavior? And as you said, they are your best resource. That's how you find out what will make a difference for them. Any questions? The end. We have time for questions. Any thoughts, reactions? I mean, there definitely is some research, and one. Oh, I'm sorry. The question is there research on generational differences? You know, the younger generation versus the older generation, are they experiencing stress differently? And I would say that yes, there is a lot of the research on the younger generation right now is showing that they are demonstrating higher rates of depression, anxiety, and a lot of that. I mean, you know, think about, unfortunately, the impact of smartphones, you know, technology, you know, that constant input, you know, and if you think of stress from the perspective of balance, that completely throws them out of balance because all of their energy is going toward this constant input, and it's exhausting and draining. Social media, you know, we know has a strong impact on the younger generation. Older generation employees who are dealing with maybe aging parents, you know, things like that. Each generation sort of has their own stressors, but certainly the younger generation is showing much greater signs of stress, anxiety, unfortunately. Yeah. So the question was about suicide and how it's increasing in all demographics. Suicide is such a complex, it's such a complex issue. We definitely are seeing certain professions, physicians being one, where suicide rates are increasing dramatically. And, you know, what I would say is, you know, again, if you think in terms of stress as balance, you know, our lives are becoming increasingly out of balance. We have an energy crisis. There's way too much expectation for output and very little emphasis on rejuvenation and input. And, you know, suicide, you know, when it comes to depression, you know, it's a progressive disease. Unfortunately, you know, again, going back to what I said about breaking the silence, the more we talk about mental health, you know, the more people feel comfortable acknowledging what they're experiencing. Is that going to ultimately prevent suicide? You know, I don't know. I think the jury is still out. There's a lot of research being done on that right now. But I think what we can do is really focus on, you know, just making mental health a normal conversation. You know, going to see a counselor is no different than going to see your primary care doctor or your dentist for prevention. We have to treat our mental health the same way we treat our physical well-being. And we just got to make it normal and part of our daily, you know, routine.
Also, in emergency services, there's a big spike in
Yes.
suicide, depression, and burnout, and whatever you want to call it. One of the things that they're seeing in these studies or whatever, it's some programs that are sort of, UMass has something called Code Green. That for when you go to talk to somebody at an EAP, it's much more beneficial and there's a lot more buy-in if the doctor's talking.
Right.
Or a cop's talking.
Yep.
Environment's talking. Because they buy in because they've been through this shit.
Yeah.
You can see things better from my perspective than just somebody that's an academic psychotherapist.
Right, right. So the comment was related to EMS and the spike in suicide with first responders. Certainly that's true for the state police. There's been a lot of documentation of that recently, but there's value in setting up programs where somebody from EMS is able to talk to a colleague. Yes, through peer support. And that is absolutely, that has been our experience as well. We've created a program at the Lehigh Valley Health Network, Physicians for Physicians. We're going to try to do the same thing for nurses. I think it's a great, you know, if you can set up some type of mentorship with your employees so that employees are able to be mentored by other employees, it definitely helps. It makes it easier for them to talk and to share their struggles. Any other questions? Yeah. Go ahead.
Just for the WebEx. It's actually more of a question observation. You had one slide up there. It was a culture of, I'm trying to remember the header. It was creative, well.
Culture of well-being.
Thank you, culture of well-being. I, just attending various OSHA events, we always hear culture of safety, right? And we've spent exhaustive time, sometimes at these, sometimes at other events, talking about creating a safety culture. And one of the things that when I was listening to Carolyn prepare and then went to OSHA best practices, is the correlation between the two. Like a lot of companies are now doing things to promote their safety culture. And there is a lot of correlation. I see the articles come across about how the mental, the stress aspects impact safety because, you know, I never name names to protect the guilty, but I remember one a year or so ago. I had worked for small manufacturing, 15-year veteran, and was out for 6 months because he missed the rung on the bottom step, the bottom rung of a ladder, fell backwards, caught himself, broke his wrist. The guy had been walking up and down this ladder for 15 years. Why did he miss it? Well, he had a lot of stuff going on. I believe aging parent was one of them, but he had a lot of stress going on. His mind was somewhere else, missed it, hurt himself. And so the correlation between stress and safety is there. I mean, it's real. And so the thought that had me going was creating that well-being culture can be the same as your safety culture. A lot of companies have safety briefings. They maybe have morning stretch programs. Sorry, my watch is beeping. That's why I'm doing that. There's a lot of things we incorporate for our safety culture. And I guess I would say the challenge or the recommendation is in those efforts, safety committees, can there be a portion of that carved out for some of these techniques, for a 2-minute breathing exercise, when talking about your safety committees, or when your safety committees are talking, perhaps put stress relief as one of the topics you're having them discuss. And that might be a way to take an infrastructure that's already there, again, to Carolyn's point, that's focused on the physical aspect of keeping everybody safe and productive, and incorporate a little bit of that mental into it. So the habit's already there to a degree.
Right.
So I just wanted to put that correlation that I got from my perspective. Not so much a question, but
Yeah, I agree. Yeah, definitely. Strong correlation between stress and accidents. Any other questions? I have a question for all of you. Do you have any ideas, or have you tried anything at your setting that you think was really effective? Have you implemented any strategies, any systems that you think are making a difference for your employees? I mean, this is a great resource right here, talking to one another about what's working in your setting. So the comment was about marketing the EAP program, and I'm glad that you mentioned that, because I think that the best way for an EAP program to be marketed is not just through HR. I think HR is one way to do it. I think what's more effective is training leadership, to really understand and feel comfortable talking about the benefit, and then routinely adding it to meetings. Every time there is a meeting, talk about EAP, and identifying that our workplace is stressful. We're dealing with stresses every day. Don't forget that this benefit is available to you. Posters, brochures, you mentioned. Yes, that's great. Any other?
You had mentioned to me one typical utilization rate is of an EAP program.
Yeah, it makes me sad every time I say that. EAP programs are grossly underutilized, and I would say on average it's 1 to 2% of the population utilizes EAP services. Companies that market heavily and really bring EAP on site, use the training and development resources, I think the utilization is much higher. So I think we can all agree that the utilization rates are not low because our employees are not stressed out, right? We can't, and sometimes I hear that from employers, like, I guess that's a good thing that only 1% of our, population is using EAP services. I'm like, is it a good thing? Or, I mean, and again, that's when you have to really know your population. Yes.
Yeah, it's not realistic.
Yes. And, the statistics around mental health are 1 in 5, the generally accepted stat is 1 in 5 adults are experiencing some type of mental health concern, and only about 33% of those who need help are getting help. And so that leaves us with a very vulnerable workforce. a very vulnerable workforce. And medication, you know, is only a small part of the solution for many people. You know, it unfortunately is not effective for a large, you know, population. Yes.
So, one of the things that, of course, you know,
Mhm.
the one that comes, we do bring, so I work for the city of Allentown, and, done so recently in a couple of different capacities. We had a situation where, a couple of our employees were hit by, and there was a lot of turmoil in that department. They were actually in the, they were doing, you know, in doing their job in the course of duty. The car actually came up on the sidewalk and slammed one employee into another employee. So it was very traumatic for that department. It was very traumatic for the people. So we, not just for those who were involved, but also for the whole department. So we actually brought EAP on site to work with the people who were directly involved, but also those in the department, because there was a lot of stress around what was going on with colleagues. So we do bring the EAP on site. We also bring the EAP on site. One of the services that the EAP provides that I think is really underutilized, and that is that they do. So we have managers that have been identified, and we actually, Carolyn is our contact person. We have people assigned to spend time with Carolyn and for an hour, and she comes back. So it's you know, there's multiple opportunities, and so it's people who are experiencing either challenges or stress or just wanting to understand a little bit better about how to be a better manager, how to better connect with people. And so by bringing EAP on site, having the managers get coaching, and I'm sure there's some counseling that happens in those meetings as well, but we're also helping those managers see how connecting with an EAP counselor can help them, not just with work situations, but also you know, with home situations. It's new. We just started doing it. We've only had 2 sessions so far, but I look for an increase in utilization. We did the same thing at Just Born. We did, when I used to work at Just Born, did see an increase in utilization. It was a smaller scale at Just Born, and we use more of the training and development aspects of it as well. We will do that eventually, but it's really exciting to be able to have people, managers, sit with an EAP and focus on becoming better as a manager.
You need me to.
Well, I was, yeah, could you just repeat that word for word?
Yeah, right.
No, if you could just repeat.
Yeah, this basically in summary is the value of bringing EAP on site to deal with traumatic events, to deal with coaching, you know, specifically working with managers. And the more we are in front of employees, the more comfortable they feel. It feels like a part of their normal routine. And it takes the stigma out of it. You know, when I go on site and I talk about EAP services, I really try to present them as preventative services. You know, again, I just liken it to going to a dentist or going to a primary care doctor. You know, sitting down with an EAP counselor, whether you have a situation or not going on in your life, it's an opportunity just to review how well are you coping with stress. You know, I just met with a group yesterday, and we're going into the holidays. We all know the holidays are stressful. When was the last time you sat down with someone and said, let me think about what I typically experience over the holidays? Dealing with family is stressful, right? And we know we can anticipate some of those stressors, but we very rarely take the time to evaluate how can I do things better this time around so I don't get overwhelmed by the stress. We often just kind of go through it, you know, and we just keep going through those same stressors over and over again without taking the time to reflect on how can I do that better? And that's a great way to use an employee assistance program.
Sorry. I always like, my role in business development is I have to learn all these things. And those of you who've talked to me, I don't have a medical background. So some things, though, when I talk to Carolyn in meetings, part of my job is to take things that doctors and counselors say and then get it down simply for people who aren't doctors and counselors, and the best way to present it. And the one time I remember when Carolyn just said that, we were having a conversation of all the services EAP does, and one of them was coaching. And on my sheet, it's like, well, coaching from a cost point of view is the same as counseling. And like, I'll pretend I'm at AA. I am an EAP user from 20 years ago, so I'm a big fan. And I said, well, I get what the counseling is. What's the coaching? And Carolyn went through the whole explanation. I said, so basically coaching and counseling are exactly the same thing. Coaching sounds a lot better, but coaching is just proactive and counseling is the bleep just hit the fan and now I have an issue and now I'm going to go because I had this issue. Otherwise, the process is exactly the same. Where I very much, that's why I try and get that across to people. Coaching is just, I'm going to just say what's going on. I'm not in crisis. And that, I think, is a huge thing that I, as a manager, try and get across to people. And I share that perspective. If I say to, and I have teenagers, if I say I want to send you to counseling, that's going to go over like a lead balloon. However, if I say, I'm going to have you go to coaching, okay, well, I have a coach, I have a volleyball coach, basketball coach, whatever, that's much less stigma to it. So as a way to bridge the gap, I highly recommend that one for everybody.
Other questions? Any other strategies that you've tried that are working well, or
I think we have anything else?
Provide buildings scheduled right after work. It's in a convenient location central to the city, and the idea is to give people that chance to be active easily.
Right.
In a fun way.
Right.
So the jury's still out. It's not as utilized as we'd like. We're going to give it a chance.
Right. Yes.
Another place I worked at, I thought this was a great idea. Share massages.
Mm-hmm.
On lunch, for 2 hours for the lunch period. And it's that typical $1 a minute, they pay for it, but they just got somebody in, the company got somebody in, arranged for it, and then individuals paid that, I think it was a minimum 10 minutes, so you paid your face in the toilet bowl.
That's called a swirly.
So two comments. One was about providing Zumba on site and making it easy and accessible. That's happening in the city of Allentown. And then another recommendation for chair massages, which we all can agree is a good thing. So, okay. Well, thank you very much for your attention this morning. And certainly, if you ever have any questions, or if you're trying to implement a strategy and you want some input or feedback, you're welcome to reach out to me directly. So thank you so much.